Waiting for it. It's spinning. There it goes. All right. Hey guys, welcome back to Hope with Jonathan. And tonight I have a special guest, Dawn Kurkowski, and
Yes.
she's a 20-year uh, transplant patient, and I'm a 2-month transplant patient. How you doing, Dawn?
Great. Congratulations on your 2 months.
Oh, thank you very much, and congratulations to you for 20 years. Wow,
Thank you.
that's a very long time, and you have a lot of experience with transplant.
Yes, I do.
Well, you are also a mental health clinician.
Yes.
Uh
I'm a
huh.
therapist
Uh huh.
for a mental health program for crisis mental health, treating people with depression, anxiety, all of those kind of things. And I'm a
Uh
I'm a
huh.
licensed therapist in New Jersey.
Okay. Well, great. So I'm sure people love to come and discuss things with you, and especially their any kind of issues that they're having.
Yeah, we do a lot of work like that, and right now, especially with the climate during COVID, we're doing
Yes.
video chats and on the phone. But we've been very busy due to the stress and anxiety people are having right now.
Okay. Do you guys use Zoom or what are you guys
Uh,
using?
Something called telehealth, and people just get
Oh,
sent the link, kind of like this, and they log on.
yeah. Okay. Yeah. Telehealth. Uh huh. All
A
right.
lot of
Well,
doctors are
great.
doing it.
So, with your experience in with 20 years in transplant, what could you tell a guy like me that's only 2 months in? What could you tell me to expect going down in the future?
Well, I'm sort to put this like advice during going forward is keep aware of what your body's doing on the transplant meds and any other medications you're on and follow up with your doctor because the truth is none of us really know what the long-term side effects of these medications are going to be for us in the future. So I think
Right,
that's very important to know your body.
right. So, like I've already been like taken up a notch in the Prograph. They did have me on one Prograph, and then they moved me to two Prograph. And I noticed after they upped the Prograph along with the CellCept that, and these are the immune suppressants for those of you that may not know, they've caused the Prograph has caused a slight tremor in my hands, so I kind of shake a little bit.
Hmm.
And I asked them about it, and they said, yeah, it's common. So I was like, okay, so that's already one side effect that I've noticed from the medication from the immune suppressants. So I get what you're saying, though. So it seems like the medications, there's different medications that's probably going to do, different things to my body that I'll experience, I guess, over time. Um,
Yes,
uh-huh. Now you
but
went on
everybody's a
this.
little different.
Oh yeah, as with dialysis and
We're
everything, each
all
patient,
different.
yeah, all different. We're treated a little bit different with different supplements and different ways of treatment and all that stuff.
Yeah,
So
20 years ago it was different. So it was a little bit different. I understand you from what you told me you're not on any prednisone.
so no, they did a breathing treatment in the hospital right before I left. They took me down and did a breathing treatment and said that after I had this breathing treatment that I wouldn't need the prednisone. Uh, I would be taking Valsite and Bactrim as
Okay.
antiviral medications.
Okay.
So eventually they'll wean me off of the Valsite and Bactrim, and those will go away at different times of my. So I think like at 3 months they're going to take me off one, and then at 6 months take me off the other.
Something like that.
Is the
Yeah, everybody
Yeah.
gets given those. I had those and probably within the 6 months I was off most of them.
Uh huh.
As time goes on, the good news is it's less and less medication.
Okay. So
So, go ahead.
well, I was going to ask you. So 20 years ago, uh, describe how your transplant. happened in the hospital? Like, explain how it went for you. Because I
What do
want to
you?
kind of compare it to what my experience was.
Guess I'll start right before the transplant. The
Uh-huh.
um, the phone call, the experience, what they told me I needed to have. So before transplant, I needed to have, of course, a battery of tests done ahead of time. Check for any problems with my heart, EKGs. What
Right.
else? Colonoscopy.
Yeah.
Uh, basically every test that you can imagine. They said have a dental checkup because on the immune suppressants, you won't be able to go to the dentist for a while. So they wanted the checkup pretty much head to toe, which I believe is still the same, right? They still do that pretty
Oh
much.
yeah.
Yeah.
I was gonna go get a flu shot, and they said we want you to wait at least 90 days before you get any vaccine. So I'm waiting till pretty much after November to go get my flu shot because
Right.
of that.
After that you can. After that, it's
Yeah.
just like anybody else because they're afraid of if you
Yeah.
have a live vaccine in the flu shot that you could get symptoms and get more ill. So they don't want that.
Yeah.
So that's pretty much the same at the start before that. I know that with me, they needed blood type and tissue typing. And when I was at the dialysis center, by the time this happened, I was on hemo. And previously to that, I was on peritoneal. So,
Okay.
um,
So you experienced both sides of dialysis. You did peritoneal and hemo.
yeah.
Uh-huh. Did you do
So,
home hemo or just hemo in center?
in center, it was sort of an
Okay.
emergency. I had peritonitis.
Oh,
Yeah, worst
okay.
feeling in the world. So
Okay.
basically, after that, then the blood, I hadn't been at doing hemo for about only 8 months, 2.5 years I spent on peritoneal. So
Okay.
when I got to hemo, by the time I got the transplant, they were lacking like blood and tissue type. And
Uh-huh.
so they're supposed at the dialysis center, something important is they're supposed to take the blood and the tissue typing before that, especially if you're going for a deceased donor transplant, to make sure that
Uh-huh.
when one comes out, they could automatically test. But a funny story,
Okay.
I'll tell you, is when that happened, they didn't have the blood type, so I had to call my grandfather for a ride because I don't drive and he lived
Uh-huh.
up the street from me. And I said, "You have to take me to the hospital. The hospital needs blood." And he was kind of confused. He was in his 80s, but he knew what I was doing. And
Okay.
uh, and I had to wait. And they said, "You need the blood within a certain amount of time so that you can possibly get this transplant," which was a lot of pressure for me. And
Oh,
so I called
wow.
my grandfather back again, and I said, "Is Pop Up leaving?" And my mother said, "Wait a minute. He's got to put his teeth in." So it was kind of funny moment. I had to wait
Yeah.
for my grandfather to put in his dentures to pick me up to take me to the
Okay.
hospital. So we
Okay.
shoot all the way up to the hospital, and it's like an hour, like roughly about an hour trip, and he's driving fast, taking all these side roads. Grandpa, it's pretty great that I had a grandfather like
Okay.
that. And
Oh,
he
yeah. Oh, yeah.
and then so he brings me back, and then I say, okay, look, I got to wait a few hours to see if they can do all this matching stuff. And then basically I had to go back up to the hospital to pretty much what do you call it, to wait. And then again they do all these battery of tests,
Okay.
and pretty much it was just waiting in the hospital while I was waiting back home for them to see if there was a match, if it was an official match. I was the fourth person in line for that kidney.
Oh,
So one
wow.
of the yeah, it talk about stress. So in the
Hmm.
meantime, I call
Yeah.
everybody, family, friends, say, hey, look, this is happening, or most likely it's going to happen. And
Mm-hmm.
one person was sick, one person was pregnant, and I forgot what the other person was, but I was fourth in line and got it.
Wow.
So, so that was pretty crazy.
That was just
Um,
fate for you, right?
yeah. Well, there was more fate. My mom was going to give me a kidney. She was a perfect match. Found out that she had the same kidney disease that I did. So there was no luck
Okay.
there when she tested. Um,
What caused your kidney failure?
Basically, focal mental glomeruli sclerosis, it's
Okay, so
called.
FSGS.
Yeah. What caused yours?
Mine was type 2 diabetes and hypertension.
Oh, okay.
Yes.
So that's completely different when it causes that.
Yes. Your disease is caused from the failure of the glomerular.
Yeah, it's basically it's just a kidney disease. I had
Yeah.
high blood pressure prior to that.
Uh-huh.
I know. Oh, and I didn't know what it was from, so I didn't have a high blood pressure problem. Basically, until I probably started to get kidney disease. I didn't know I had kidney disease until I had 50% function of the kidneys left.
Wow. Wow.
Yeah.
So
So
when you had your transplant like 20 years ago, like how long did you have to stay in the hospital and all that? Like go into the details of that.
okay, so I was there probably a little longer than most people. Um, and back then they let you stay at the hospital longer. So I was there about 7 days. They were
Okay.
trying to get the creatinine down and concerned
Right.
about risk of infection. The other thing is they tried me on an anti-rejection medication that was still in a study. So they
Oh,
couldn't
wow.
home right away and they wanted to see if it would actually work.
What was the name of that one?
The generic is sirolimus, and the regular brand name is Rapamune.
Okay. Okay. Well, just to compare on my end, my I ended up having my transplant in San Antonio at Methodist Specialty and Transplant, and I tell you, advancing down to 2020, they've got it down to just like a literal science. I mean, you go in and they get you prepped. You're in and out of surgery in no time, and basically they know which pain meds to give you. And I was in and out of there in just a few days,
Wow.
and the recovery was just. It seemed like everybody was so relaxed in recovery. Um, the nurses and the whole staff just seemed like they were very, very relaxed. As if they had done it 100 times before. So, just Methodist was very modern, and the way that they did everything was just like so textbook. Now it's like I guess because and it should be after they do so many of these transplants, you would think by now that it would be like that, but that's how it was for me.
There's like thousands of them done now. It's like almost like old hat to these surgeons.
Yeah, yeah. They were so relaxed. I mean, they acted like it was just another day on the job. For me, of course, I was a patient laying there, getting prepped and everything. I had 1,000 thoughts going through my mind. A little bit of anxiety. Worried about this and that, but overall, it was a very positive experience. I can't really think of too many complaints. So,
Yeah, I can't really either. From what I remember, I mean, the hospital I was at was St. Barnabas Hospital in Livingston, New Jersey, not far from my house.
okay.
So that now they are considered one of the top notch. For anybody watching who's in New Jersey waiting for a transplant, St. Barnabas is one of the top centers in New Jersey. They do thousands of them with almost a guaranteed 100% success rate, or at least for the first year.
Okay. And on my end, San Antonio is one the Methodist hospital where I had mine was rated a very high hospital as well.
Mm-hmm. That's
So we
important.
both had great hospitals that we were going to.
I think that's hugely important to when you're listing, see what the hospitals are and see what
Yeah.
their ratings are. Call somebody, talk to them ahead of time to make it less
Mm-hmm.
scary. And now there's a lot more
Yeah.
wonderful access to information that I wasn't privy to back then because I had to find it in person. I mean, I had the
Uh-huh.
internet, but it wasn't the same. Like I don't
Yeah.
know, like AOL.com and Messenger were about it. You didn't have this. You didn't have groups like the Urban Media Group with Steve Belcher.
Right. Right.
Yeah, nothing. I mean, I had National Kidney Foundation. I've received a lot of mail from them, and of course the AAKP, American Association of Kidney
Yes.
Patients.
Yes. Actually, I wanna let you know. I don't know if you've seen or not, but I'm now an ambassador with AAKP. So I'm pretty excited about that.
So what will
So
you
I
be
plan
doing as
on
an ambassador?
just continuing to advocate and work with that organization to just continue to advocate, get the word out about kidney disease, and just continue to advocate for patient rights and stuff like that. So do fundraisers, things like that.
Pretty
So
exciting. Congratulations.
oh yeah, it's very exciting. My passion for all this is because of my personal story and journey with kidney disease, and that's where I'm. Prior to my kidney failure, I knew I had no knowledge of kidney disease or kidney dialysis or anything. I never seen an ad on television. I never seen any kind of notifications. Just information from the doctors, but it was real vague, information. So I think in the future, I'm hoping that people take kidney disease as serious as they do, like for instance, like a breast cancer awareness. I mean, uh, you see breast cancer awareness everywhere. You even see TV ads for it. You see pink cups everywhere, pink hats, pink ribbons everywhere. But I'm hoping one day that kidney disease is recognized as much as breast cancer.
Mm-hmm. Yeah, we should design our own hats and shirts and put them out there, and I don't know, get awareness out there. I mean, donatelife.org has their own merchandise that they sell, but maybe
Yeah,
patients should decide to design some things
yeah.
themselves to get it out there.
And I say that with all regard. Anybody that's suffering with breast cancer
Oh,
that's a
absolutely.
terrible disease, and God bless them. And I support completely breast cancer awareness. I'm just using that to compare,
Yeah.
to kidney disease. There's not a whole lot of information getting out there, and it's 2020. So that's one of the reasons why I'm becoming an ambassador and advocating, and I share what I do on social media because if nobody tells anybody about this information, then it's not going to get out there. So
Mm-hmm. I think one of the things people have to share is kidney disease and the risk factor of it for diabetes and high blood pressure.
yes,
How would you know if your kidneys didn't fail that the cause of it could be the high blood pressure or difficulty controlling diabetes?
right, yeah, and
That's
the
one major
symptoms
question.
and signs are pretty evident, like blood in your urine, or even really bad foam in your urine, pain when you urinate, things like that. I mean, you should definitely go get that checked out. If you're listening and watching, you should definitely inquire and go see a doctor. A simple blood test will let them know, where you're at as far as
Absolutely.
kidney
It should be
disease.
part of
Yep.
regular physicals. We need to advocate for those tests to be part of a regular yearly physical because some
Yes.
diseases don't really have symptoms per se. Like mine didn't really have any symptoms of what you could recognize even as kidney disease.
Yeah.
Um, yeah, so I had a job where I was either sitting all day and my feet would get a little bit swollen, but I just figured it was lack of circulation. I figured I was just sitting there and maybe I didn't
Yeah.
exercise enough. And then I went to exercise and I got leg cramps. Well, I figured maybe I was stressing for exercise. I mean, to the common person, they think what I thought is kidney disease. What? No way.
Yeah.
You know,
Well, I was the exact opposite. I had urinary tract infections, and I had blood in my urine, and I had really bad foamy urine, and Of course, my every time I'd go get antibiotic, and they really never discussed with me that my kidneys were failing. They just said you had a UTI, and and I looking back on it, there was probably signs of kidney disease then, but I wasn't told until a couple of years before my kidney failure that I had kidney disease. And at that time, they told me I was stage 3. And I didn't really take it too serious. I kept just continuing to do what I wanted to do, eat what I wanted to eat, and I wasn't managing my diabetes or my hypertension the way that I should have been. And and I was one of these ones that never went to the doctor unless I was going to die. And that's almost what happened to me. So because of my stubbornness and my not willing to comply, it almost cost me my life. So it was a very, very crucial moment in my life. I was like 30 minutes from death, according to the doctors.
So I have a question. What would you tell, knowing what you know now, what would you tell your younger self back then?
Well, my younger self, I would say manage your diabetes, definitely. Take in regard your diet. Definitely exercise a whole lot more. Go to the doctor and get at least a annual, if not a 6-month checkup, and just take care of yourself a whole lot better than what you did or what I did. And I'm speaking to myself as if I was like 20 years old. I'm 42 right now.
Okay. So we're somewhat similar age. I'm 49. I got transplanted at 29. I got renal failure at where I went on dialysis at 26. How old were you when you went on dialysis?
I was just last year. I was 41.
Okay.
Yeah. 41. Yeah. I was in my center. When I showed up at my center, everybody else was like in their 60s and 70s. So I was like the young pup coming in. They all looked at me like I was a baby, But I met some really nice people and come in contact with some, great people. And they made it easy. The staff at my DaVita, I had my dialysis at a DaVita here in Kerrville. They were great. I mean, they were like family. I seen them, 3 times a week for 4 hours each treatment. So it was like they were so friendly, and we got along great. Did I have issues and stuff? Yes, I had issues. I had all kind of issues with my fistula and blood pressure issues and things like that with dialysis. But overall, it was a positive experience. And then I ended up during the COVID, like pre-COVID, right about the time that COVID had really like hit. I went on home hemo. So I did.
That?
Yeah. Well, I did it for like 3 or 4 months, and I was just blessed to get transplanted. So I didn't do it very long, but it was a positive experience. We had a few issues with like I had 3 different machines. So we had issues with one machine that just kept throwing codes all the time for no reason. So we sent that one back. Then we had another one, and it started doing some crazy stuff too. So we sent that one back, and then we finally got a good one. I will say this: I never missed a treatment because of it. They were able to send me a machine, and within 24 hours. So they always had a machine to you. But the supplies was the main thing. The supplies took up a lot of room. My first, huh?
I agree with that. My supplies took up a whole wall.
Yeah. I live in a 3-bedroom, 2-bath apartment, and so it's about 1,000 square feet or so. And I ended up like having to put some of the boxes in one area and then move some of the boxes in another area. And I made a closet for all the other supplies, and you know, we had to really try to figure it out. My first delivery was like 74 boxes, which is a
Well,
whole lot of boxes. Yeah. And
yeah, I can
they
relate.
brought them in the living room, and then I had to basically organize everything myself. So anybody out there that's watching that may be considering home dialysis, whether it be PD or hemo, be prepared to, uh, you know, be organized and all that, and definitely make sure you have the room to do it, because you're going to get a lot of boxes. Don will concur with that.
Absolutely. Make sure that you're willing to work, whether it's
Mm-hmm.
hemo or PD. You become your own
Yep.
nurse. So you have greater
Yep.
control. You have greater control with your diet and your abilities, but you have to be able to do it.
Right.
I don't recommend either one for somebody who's just not mentally able to do it,
Yeah.
or possibly somebody who might have medical issues at home where it would be very difficult and very risky. That was also advice I got from my doctor, that she's not going to put an 85-year-old woman who has trouble with her veins on home hemo. This
Right.
is what my doctor was explaining. You have to be
Yeah.
have some sense about it. Judge what your capabilities are, both mentally and physically.
Yeah, and you got to be willing to listen and learn, and definitely pay attention to what's going on. And the main thing was the setup for me at home hemo was being sterile, and the setup.
Same here.
The setup, yeah, the setup here. It would take about an hour just to get everything primed and set up and get it all ready. And you know, if you didn't, you had to figure out some steps, the way to cut some time, and you had to figure out those little shortcuts to, you know, cut a little bit of time, because, you know, if not, you would be into like a treatment for like 5 hours if you weren't careful. So you had to figure out, you know, a few little steps here and there. And some of those steps was what we would do is I would prepare for the next treatment after the treatment. So as soon as my treatment was done, I would get all the supplies for the very next treatment and have them laid out and be already prepped for the next one. And that was one way to cut time.
Yeah, PD was a little bit different. It didn't take that long to set up, but you kind of had to set it up right before each treatment, because it uses bags of dialysis, almost like a saline solution. And based on the weight that you have, you're going to select the bag to use for the treatment.
Yeah.
Where some of them have more dextrose in the bags. And so you can't do it until right before. So I was actually.
Was it dialysate in the bags? Dialysate?
Yeah, I think that's what it was.
Okay, because that's what we use.
Yeah, it was kind of like a different dialysate though. It had dextrose in it. The main ingredients was pretty much dextrose. So that would pull the liquid out through the catheter, and, you know, basically clean your body out.
Yeah. And
Long
filter your blood.
Yeah. So you could do that in two different ways for anybody who's considering to do PD. You can do ambulatory peritoneal dialysis, or you can do what's called cycler on a cycler machine dialysis. So basically, the ambulatory, you have an IV pole, and the actual doing it is like, it takes about 20 to 25 minutes to actually do it 4 times a day. So it's a little kind of a pain in the butt, because even though it's shorter time periods, you have to make sure to schedule those in increments during the day.
Okay.
So that could be good for people, you know.
Yeah, that's some great information about PD for sure. So let's fast forward. So like 20 years of transplant, what things have you experienced? Any kind of issues like that we should know about that you've experienced in your transplant? Any main like medical issues or anything with your transplant?
Yes, number of them. So I'm going to start by saying transplant isn't perfect. It's only it is a treatment and not a cure. A lot of people look at me and say, "Hey, 20 years, man, you look great. You don't look like anything ever happened to you. You don't look sick." My favorite phrase, "You don't look sick." And
Yeah.
everybody says that now, but they don't
Mm-hmm.
realize that it goes a long ways with a lot of other different things. So yeah. So one of the things, and thankfully you're not on prednisone, because that can cause some bone issues, and I know a lot of people have experienced that. I have osteoporosis early in my
Oh,
life, so I'm
yeah.
prone to fractures. Luckily, I knock on wood, I haven't fallen or broken anything in the 20 years.
Oh,
Because that could.
wow.
However, my mom, having had a transplant as well, had fractured her hip a few years ago, and it ran
Uh-huh.
down her hip, down her leg. So that so that said a lot of, even though she was older than me, but we both have osteoporosis.
Okay.
Now, for me, prednisone and one of the other medications I take, anti-rejection drugs, can increase your sugar. So I take cyclosporin, brand name Neoral, and as well as the prednisone. I got diabetes from the transplant drugs, which they said was
Oh, wow.
almost guaranteed at the time of transplant. I said, well, what's the chances that I'm going to wake up and have diabetes? He said, oh, like, maybe like 90%. So I had to adjust to that too. So it's like, oh no, I really didn't want
So,
to listen in the beginning. It was a shocker.
so when I was on dialysis, I'm a type 2 diabetic too. So when I was on dialysis, my sugars were like next and perfect. I was like a 4.5 or 5 on the A1C.
Mm-hmm.
And of course, the dialysis wipes out, your sugars once your, blood is filtered. And I
Mm-hmm.
was really watching my diet, really strictly, and following the renal diet. And of course, the dietitian came in after I had my transplant. And he said, don't be alarmed if you go home and realize your sugars are back up again, because he said the new kidney will store the sugars a little bit differently than they did whenever you were on dialysis. And sure enough, when I came home, I checked my sugars and they were already back up into like the 180 and 200. So I had to immediately call the doctor to get, more medications, or up the medications to, try to help resolve the sugar issues. And I was telling my wife, I said, man, it seemed like you trade one extreme for the other. It's
That's
kind
how
of like
it
a
is.
playoff.
It's a trade-off.
Yeah. The great thing is no longer on dialysis.
That's the
So
greatest trade-off. So you take
yeah.
the other stuff. Um, I want to say it was rough at times, but sometimes you just gotta, I guess, take it as it comes. But once you've already done dialysis, there's a part of you that's stronger inside, I think, because you're always like,
Oh
well,
yeah.
I've already had that. So
Yeah.
now I have a transplant, and you might look at the world a little different. Let me ask you at
Oh,
all,
for
did you
sure.
experience any kind of depression or moodiness after your transplant? I know a lot of people do.
Um, I've been mainly positive, and I've tried to keep a positive mindset. There's been times that I've had some emotional moments since transplant. And I don't think I've had any kind of depression. I've been, only 2 months in, but I've been real grateful and excited about my transplant. So um, I'll be honest with you, I was more depressed. I think if I was experiencing any depression, it was more so at the beginning when I had to. I was still like in the acceptance stage of accepting that my kidneys had failed, and accepting that I was going to be on dialysis. And so I experienced more depression and anxiety during dialysis stage. Not so much now since transplant. Um, I mean, I am excited about it, but like I said, I mean, I've had some days where I was a little down about the diabetes situation because, like I said, my sugars were just really great during dialysis. So that was one of the main factors that took my kidneys out was dialysis or diabetes and hypertension. So you know, I definitely now am real mindful of my diabetes and just I've incorporated a lot more exercise. So I'm doing walking to try to help with the blood circulation and bring the sugars down. And that seems to help a
Great.
lot. Yeah.
Yeah. Are
Also
you taking any
for
medication
my
for it?
mental sanity, huh?
Mhm. Are you taking any medication at this point for diabetes?
Yeah, glipizide.
Hmm.
I'm taking glipizide and Tragenta.
Okay. Are those both? Those are both
Yeah.
pills, right?
Yes, they're oral medications. Yes.
Mhm. Yeah.
Yeah. I refused to go back on metformin, and one of the reasons why was I was told by a couple of sources that metformin is actually really not that great for kidneys, and
Really
so I refused to take metformin.
interesting.
So yeah,
I
I
tried
took it
it in
for
the
a long
beginning.
time.
I tried it in the
Yeah,
very beginning, post transplant,
yeah.
and I refused. It was causing horrible stomach issues.
Oh yeah, yeah,
So, run to the bathroom every 20 minutes.
yeah.
Um, and I couldn't get to work on time because I've worked through most of my dialysis, and I've worked um, almost all the time within, except for the first couple of years, when I was, either staying home from one problem or another, or just trying to work up my immune system before I went back to work.
Mhm.
So there was just no way. By the time I was ready to work, metformin was not an answer. I didn't drive, so try to catch a bus and be on metformin and have it bother your stomach wasn't going to happen.
Yeah.
Um, yeah.
Let
So I
me
do take
let
insulin.
me. Uh-huh. Oh, you take insulin?
Yeah, I take Tresiba and Humalog.
Okay. One of them, are they both fast acting or one of them's fast acting?
Tresiba is the slow acting, long term, and Humalog is short.
Okay. Okay. Let me ask you a question. So, what was like 20 years ago? What was the follow up like after transplant? Like, how did they have you coming back every other day or, once a week or explain that a
Uh,
little bit?
yeah. So in the beginning, it was go to the clinic um, about twice a week. And I also had to sometimes go an extra time because of that. I want to say not experimental, but that new drug that I was on, not so new anymore.
Uh
Um, it had a number, not really a name back then. It was kind of funny.
huh.
Um,
Uh huh.
so they were taking extra blood for that, but we tried to work them
Uh
into the
huh.
appointment. So then it got decreased after a while to like once a month, and then it was like every 3 months, and then it followed up. The only thing is that I mean it was good follow up, but I felt like every time I went to the clinic at the hospital, it was like I saw another doctor or another physician's assistant, and I was so used to the doctor I had, I missed her so much I wanted to go back. But they're like, no, you can't go back yet. We have to follow up. I had like the greatest in the world nephrologist. I got to say, I've had her over 20 years. So
Okay.
yeah, so I was overjoyed when I could go back to her. It took a year.
Okay.
What about you?
So I'll tell you about my follow up so far. It seems like it hasn't changed much in 20 years because they had me going twice a week at the beginning, and
Mhm.
then they progressed to once a week, and
Mhm.
then now I'm going once a month to the clinic.
Mhm.
Now, locally here in my town, I'm about an hour away from San Antonio, so my clinic is in San Antonio.
Wow.
But they have me doing my weekly labs here in my local area. So I'm still doing a weekly lab. I just don't have to drive all the way down to San Antonio to do those.
Oh, that's
Um, but I'm going to San Antonio now once a month, and I guess it'll progress to maybe every 90 days, and then maybe 6 months, and then maybe to an annual. But I'm not sure.
It goes like most of the time, other people that I've talked to, they're still doing the same thing every month, and then like every 3 months, every 2 or 3, depending upon how you're doing. And then they change it to like 6 months. And when you're out a year, then you'll work with your regular nephrologist to basically schedule appointments as he or she, sees your progresses. For years, I was actually every 3 months going to the doctor after the first year, with labs every 3 months. Some of that depends on your insurance. So sometimes I was allowed to have labs once a month in the beginning, after a year, depending upon which insurance I had. I know for people out there who might be on Medicare or Medicaid, they don't allow labs to be more than every 3 months once you're after a year. So it's something to
Oh,
check.
okay.
No. One of the important things I experienced. Now, do you have insurance through your job with your transplant for medication?
No, I'm a Medicare patient right now.
Okay. Are they still saying about the 36 months that they no longer pay for anti-rejection drugs?
Yes.
That is a sin. 20 years later, here we are, same problem.
Yeah. And you know what, Don? It's literally a sin. I really feel that that law, the immune suppression bill, is being passed around right now in the House and Senate, and we've got a lot of people that are on board, but we need to convince, I think a few more. This bill makes sense, and they should pass it. They should have already passed it.
They should have passed it years
If,
ago. They should have passed it many years ago. It's been
yes.
sitting on the table too long.
So this bill is presented, and I'll tell you guys out there what it's about. It basically means that the immune suppressants will be covered for the life of the kidney instead of 36 months.
That would make the most sense.
Yeah, because if you go into kidney failure after 36 months, then it's basically the whole cycle over again. And how costly is that going to be? I mean, that's going to be super costly if you can't afford your immune suppressants.
Oh, yeah.
Which they're very expensive. Very expensive.
Yeah, you can. I've looked at what my immune suppressants would cost if I didn't have insurance, and I could buy a house, a really good house, with the mortgage of what they would cost.
Yeah, it's crazy. It really is. That bill, like I said, that bill should be passed. It just makes sense. So that's another reason why I joined the AAKP. They're for this. They want us to continue to advocate to try to get our local representatives on board with this. And our state representatives to get on board with it. So um, Ted Cruz, if you're watching, I need you to pass that bill.
We all need
to
you
get on board, brother.
Yeah, absolutely. We still need it done. It's one way too long.
Oh, for sure. For sure.
Here we are today, a 4-month transplant patient in 20 years, and both of us, still had that problem.
Yeah. I've already had a talk with my mentor, my advocate, Kent Bressler is his name. You know who probably Kent is. And we've discussed it. He's told me, he said, you only got 36 months right now. He said, you better be, trying to figure out what you're going to do. And I said, yeah, I know. I've got to, try to work through that. So that's definitely in the back of my mind every day right now, because, it's already a couple of months already, passing by really fast. So before you know it, the 36 months will be here and gone. So yeah.
I'm fortunate. I had job insurance for a while, and then when I had job insurance when I got my transplant, but they had to let me go, so I lost that, and that's when I went and I got Medicare and coverage, and had to buy a gap insurance last minute. Those are another expensive thing. Yeah. And then basically I said, what am I going to do 36 months later? So I called a social worker at the time who said to me, who I said to her, well, what am I going to do? I want to get what's called PAD, which is assistance for prescriptions, and just,
Mm-hmm.
can I stay on Social Security? And basically that's what I was doing. And she looked at me, she said, you're too smart for that. She said, you need to go get a job. You're doing good. I was kind of mad at her for it. But,
Yeah.
at almost 30 years old, come on. She said, you got your transplant to do what? To stay on disability and do that? Or you got your transplant to live a better life? And so if it
Right.
wasn't for that toughness of that social worker, I wouldn't be doing what I'm doing right now. So I was really lucky. I also found my husband as a result of that 36 months problem, because
Oh,
I went
great.
back to work. Yeah, it's kind of funny how it worked out for me. I
Yeah.
had to go
I
back to
see
work.
him. He's over here in the comments commenting. His name's Tom, right?
Right, yeah.
Yeah. Hey,
Yeah.
Tom.
So it's really funny because after the 36 months, I went back to a job that I said I was never going back. I hated it there, but they didn't know I hated it. And basically, I said, can I have the old job back? Because I knew they would hire me. It was sales for a moving company. Luckily, I went back
Okay.
because here I am with my husband over 15 years.
Oh, all right.
I
All
met him
right.
there, and well, it's a love story based on the 36 months that doesn't cover your meds.
There you go. There you go. Yeah, I plan on looking. Definitely, I've been looking because as soon as they give me the final say that hey, yeah, you can go back to work, which I feel pretty good right now, but I'm still waiting for them to give me that final say so. But I worked in technology, so I was a hardware repair technician in computers and printers and things like that. So um, I'm going to continue to start searching and see what's out there for me. I was a contract worker at the time, and basically I just they replaced me and put somebody else in my position. So I wasn't actually able to go back to being a contract worker at that time. So um, I'm not sure I want to do that again. So I may look for something that I can maybe uh, sit at a desk and work on a computer or that type of job. So, but I'm going to see. I'm going to explore my options. So for right now, but I'm definitely looking forward to going back and doing something though, because like you said, like the lady asked you if you got your transplant to basically stay at home and be on disability, or you got your transplant to live a better life. And that's what I want to do. I want to use my transplant to live a better life for sure. So
Yeah, and you will. It
yeah.
sounds like you will. You're very positive. You have a lot of positive spirit. So whatever you
Yeah.
end up doing, I think that's
Well,
the thing. It's
I
the
appreciate
attitude.
that.
It's the
I
attitude.
appreciate that. Yeah.
Yeah.
So let me ask you this. I guess in closing, I've really enjoyed this interview with you, Don. There's been a lot of information shared. But if you could give anybody out there advice that's facing transplant, uh, just if you want to, you just give them any advice that you can that's fixing to either face a transplant or maybe waiting on a transplant.
I'd say waiting on a transplant, the biggest thing is don't give up. Use social media if you can. Reach out to people like my friend Jonathan here to help advocate for you. Um, there's another great advocate out there that if you're on social media, please look up Jen Benson. She does a lot of advocacy work, and I'm on the way to becoming an advocate with her group. So she has something called transplantjourney.org. You should check it out if you haven't. And
Okay.
so they've got advocates for all kind of transplants, not just kidney. So that's something really important.
Okay. Okay.
And and you
Send
usually reach out.
huh.
Um,
After the
give it.
show, send me that information.
Yeah, we'll do.
Okay.
And don't give up hope. Number one,
Yes.
don't give up hope, because that's might be
Right.
the biggest asset you got. And I know not everybody has different faiths out there, but I want to acknowledge that. But at the same time, if you
Sure.
pray, if you have a belief in a higher power, or you're just very spiritual, use that. A lot of people find that very helpful, to pray or meditate or have faith in whatever it is that you have faith in. Keep that faith
Right.
while you're doing that. And just like I said, be aware of your body. I've also had issues with my eyes as a result of possibly the transplant or the blood flow to my eyes. Um,
Yeah.
so I have macular degeneration as well.
Mm.
Keep track of your labs. Know your labs, whether you're transplant or whether or not you are on dialysis. Know your labs, know what they're doing, and definitely, check that out. Before we end, like I said earlier, I wanna go ahead and plug something for a friend of mine.
Oh,
Um,
sure.
so I want to show you first. For people who don't know, this is the wonderful Hal the Owl, and I say he's wonderful because he was created um, by my friend Brenda E. Cortez, and you can check her out on Facebook with a couple of things: Howl the Owl, Howl's Heroes, and basically, it was designed with books by Brenda E. Cortez, who is also a living donor um, for a transplant. She created Howl and many books that she wrote in order to educate people about transplant. So she has books about dialysis, books about transplant of a liver, a kidney, and Hal is a very special owl. He also has a heart transplant. So I want to also mention there's this wonderful book here. I don't know if you could see it. Hal learns about kidneys and dialysis. So it's a great
Okay.
story for both children and adults.
Okay.
That basically tells people in more simpler terms about dialysis. And
Okay.
it's wonderfully illustrated and very easy to read. Even something like that to start with would be very educational and teaches people about kidneys and dialysis. So I want
Okay.
to plug Brenda E. Cortez, and for people who don't know her, take a look at her website. And if you'd like to order any books or order this cute little Hal the Owl, um, you know, you can tell her that Dawn Kirkowski sent you. And basically, they're great because, and some of the proceeds go to Donate Life. So
Okay.
so
Your husband Tom just chimed in with HAL stands for helping others with love.
absolutely. So that's why he has this little T-shirt on, helping
Uh-huh.
others with love. And I want to
Yep.
mention an important person that why I have this little Hal here before we close. You might have seen her. There's a friend of mine, Jean Sim,
Uh-huh.
transplant for 1 year now.
Uh-huh. Hi, Jean.
And
She just commented a minute ago.
oh, okay. Well, Jean and Brenda, they did a most wonderful, beautiful thing. Jean unfortunately lost her sister, who was a nurse due to COVID,
Oh, sorry
and
to hear that.
yeah, but she has been out there with the help of Brenda. They created a program, House Heroes, which was to honor the memory of her sister Vivian, um, and basically, carry on the caring and the compassion that Vivian gave to others as she was a nurse. And so it's very special to Jean. So this Hal's hero there, her and Brenda go around and they basically give Hal to people who are essential workers, and that's why I have Hal here. And it's a very, very special program honoring people who are dedicated workers during the COVID crisis. And Jean, if you're out there, I'm
All
sure
right.
your sister is smiling on you. So I, wanted to mention that it's very special.
All right. Well, all right. Well, shout out there to Brenda Cortez, and it's Hal's Owls.
Yes, and she's the
Okay.
author and
And
the creator of this character. And Jean Sim and her created Hal's Heroes, which is such a wonderful thing, making people
and
happy.
okay. And you can find that on Facebook. And How's Owls. And I actually follow that as well. And I've seen some really cool posts. And I thought the idea was really great. I think it's a real awesome idea especially geared toward organ donation. We need a whole lot more education and advocacy for organ donation.
Yes.
As you know, there's many people out there waiting for transplant, and there's just not enough organs or donors to go around that's willing to be a donor. A lot of people don't understand it. So many people I've come in contact with have no knowledge of kidney disease or how kidney dialysis works, or even how they believe that if they give you their kidney, they will probably die, and then you have to educate them and say, hey, no, you can live with one kidney. So there's a lack of education and knowledge out there that we need more great programs like the House Owls and different things like that, the urban medias, different
Media,
programs
yes.
like this.
The organ procurement agencies, ask them for information. They can provide you information about the truths as well as the falsehoods that are being spread around about organ
Yeah,
donation.
yeah,
You can get involved with them as a volunteer. I know mine, the Sharing Network in New Jersey, allows us to volunteer and spread the word. Right now, it's being done through social media, but people do go out and speak. When there's not this COVID thing going on, but once it's all safe, we'll be all doing it again and advocating and speaking to people. So there's many ways you can get involved. There's the National Kidney Foundation. Contact these
right.
organizations. Help to spread the truth about organ donation and
Yep.
receiving a transplant. It does seem like more and more people in the last 20 years need a transplant because
Okay.
they know nothing about taking care of themselves or even just symptoms or anything. So we need to educate
All right.
before people get sicker.
So we got a couple of comments here. Gene Sam says www.howtheowl.com. So they have a website. They
Yes.
also have multiple Facebook pages. How the Owl. Uh, it looks like How's Heroes and How on the Prowl.
Yeah.
So
That's a
that's pretty
that's a fun
cool.
that's a fun Facebook
And then,
page.
okay. And then another one, she said www.transplantjourney.org.
Right. That's
So
the one I
there's
mentioned about Jen Benson. Yes. Shout
okay,
out to Jen
okay,
Benson. Yeah.
all right.
So great
Well,
resources here.
we've spread a lot of information. We've shared a lot of information. And Don, I really appreciate you coming on Hope with Jonathan. I really appreciate the information that you shared in your personal story. And you know what? We need to get together and do this again. I think we collaborated well, and we talked, and discussed kidney disease, dialysis, and transplant. We discussed a lot of great things. So we should, do this again sometime.
Sure, that would be great.
All
Maybe
right.
we should talk about other topics, mental health and kidney disease or
Sure.
whatever else comes to mind. What would
Right.
be interesting is to try to talk about. I know Steve is going to do a program on urban health media that people should really get to see about relationships. But I think we could collaborate, being both married people, about how our diseases might have, affected our lives. Being married and our
Sure.
relationships, because it really does play a role in your relationship with your spouse, your partner, significant other.
Oh, for sure. For sure. The effects of kidney disease do not only affect you as a person, but it affects everyone that's involved in your immediate family. So, it affects everybody. So,
Yeah, absolutely. That would be a cool show to do.
well, maybe we'll get together and do that, Don. We'll work out the details. Maybe I know you had talked about possibly doing a show of your own, possibly one day. So, we'll
Yeah, we can
see.
get that up.
If you get that going, and then maybe I can come on your show and be a
That would
guest.
that would be great. All right, I'll keep that in mind. You'll be one of my
All
frequent
righty.
guests. All right, thanks, Jonathan. It's been great.
All right. Well, thank you, Don. Hey guys, thanks for tuning in to Hope with Jonathan. We'll see you guys. I've got another interview on Tuesday. I have another kidney patient that I'm advocating for. So guys, check me out on Tuesday night. Y'all take care. God bless.
Will do. God bless and stay strong.
You too.